Thank you and good morning. So for today, as mentioned, we're going to be sharing our latest modeling data and epidemiologic data for the pandemic as it is in BC. And then this afternoon, we'll have a statement with today's numbers. So what we are going to talk about this morning is, again, how and where the virus has affected people in British Columbia. To start off with, geographically, this is the distribution of where cases are by health service delivery area. So updated on the left is the cumulative total since the pandemic started last year, and on the right, the past 7 days. And as we can see from this, we have had ongoing transmission in areas that have not previously been heavily affected in British Columbia, particularly in the north and the interior of BC. And as we have had more cases, we have presented data at a more granular level. And this is the data, the geographic distribution of our cases by local health area of residence. And by convention, we always present the data by where people live. And that's what we have done from the beginning. And of course, across Canada, we do that the same way. So that does not always reflect where people have been exposed to the virus or become infected. But by local health area, now that we have increased numbers of cases in our local health areas, we can present this data more frequently without risking re-identification of individuals. This tells us that there has been no area of the province that has been spared from this virus. And in the last 2 weeks, we have seen spread particularly in areas that have not yet seen such spread in communities in the interior and the north in particular. And on a positive note, we've seen decreased activity in some of the hard-hit areas early on, particularly in the Fraser Health region in the Surrey area. This is the profile of our cases over the last couple of weeks. We've had 3,000 new cases this week and 108 people newly hospitalized. As you can see, our epidemic curve increased and peaked in November. It has come down. We did see a bit of a blip again early in January related to transmission over the holidays, and we've now flattened and slowly started to decrease. This is the same information presented by the date of the lab test or report, and it goes back only to the summer, but it shows the progress that we've had in our second wave of the pandemic here in British Columbia. Again, the majority of cases happen in the Fraser Health region, but what we've seen more recently is a steady decreasing in Fraser Health, which is really great news, but an increasing in some of the other health authorities, particularly the interior and the north, and also what we're seeing in Vancouver Coastal most recently has also increased, and that is we're seeing more cases in areas like Whistler and in the North Shore Coast Garibaldi region of Vancouver Coastal Health. As I mentioned last week, we have plateaued. We've started to slowly decrease again, and that is important for us, and we'll pay more attention to that in the coming slides. This is the epidemic curve by episode date. So that's by when the date of onset of illness for people. So that gives us a better idea of the time frame when people are getting infected. And we can see from this slide that we continue to have the majority of our cases are people that we can link to a known case, cluster, or outbreak in our community. And about 20% of cases still we are unable to find the link to their exposures. And we've been watching that quite closely. During the peak in November, we had challenges keeping up with contact tracing across British Columbia. We are now doing much better at that as cases have come down, but it has been a strain, particularly in areas where we have fewer resources in areas in the north and the interior health region, for example. We still have some cases related to international travel, and that, of course, is most concerning in these past few months as we've identified variants of concern, we're calling them, that have come from parts of the world, and these variants have led to increased transmission in some areas of the world. We see that in the UK, in places like Portugal and Ireland. So it is very concerning for us that we manage and prevent repeated importations of these types of variants. This is the epidemic curve broken down by different age groups. We can see very easily that the top age group, the 20 to 29-year-olds, continues to be the most frequent age of transmission and people who are becoming infected with COVID-19. We did see a decrease, a steady decrease leading up to the Christmas break, but then a rapid increase again related primarily to social events that were happening over that break. We also see that it's people between the ages of 20 and 49 which are driving the pandemic at this point. And we've from the data that we have on the ground from public health, we see that there's two different areas where we're seeing transmission events happening. One is in social gatherings and interactions, and that tends to be in the younger age group. But then we're also seeing workplace transmission and sometimes quite large outbreaks in workplaces, but transmission events in the older working age category. The things that are important to note on this is that we have seen, again, low rates of transmission in the 10 to 19 and the 0 to 9-year age groups, and those have come down. There was a peak after the winter break where there was transmission, likely related to social events over the Christmas break or the winter break. But we're now seeing, once schools are back in place, that transmission rates are going down again. And really importantly, we are finally seeing a concerted and continuous decrease in transmission and cases in people over age 80. And that is very gratifying for us as it reflects the protection that we've been able to provide people primarily in long-term care homes from the immunization program that started in December. This is looking at our case rates and testing in BC overall and by different health authorities. And just quickly to say that the background gray shadows gives us a sense of how many tests are done per day. And then the colored line is the percent positivity in a rolling average. The good news on this slide is that we've seen a steady decrease in both testing percent positivity and numbers of cases in the Fraser Health region. It has been lowering and finally coming down again in Interior Health and Vancouver Coastal, with a bit of a blip here in the last few weeks. Most concerning is the areas that we've seen quite high percent positivities in the north, and that reflects transmission in several communities across the north. That is now coming down, but still remains relatively high. This is the same information broken down by age groups, and particularly we look at this to help us understand transmission in specific settings. And the 5 to 12-year-olds and 13 to 18-year-olds, a group we watch very carefully as school-age children. We can see in the background that there's a big spike in September, and that was when a lot of testing of school-age children was being done at that period of time, although the positivity rates were very low. They have come up in all age groups as our second wave progressed, reflecting transmission in the community. But we are not seeing accelerated transmission in school-age children, which is also very important, and where we're seeing the most transmission and the highest percent positivities are in the 19 to 40-year age group, as we talked about before. And again, we see a nice, steady, finally, decrease in transmission rates and with high testing in people over age 80. This is a reflection of how our healthcare system is being impacted by our pandemic. As we can see, the cases peaked in November, and hospitalizations a lag indicator, peaked several weeks later and have now come down but leveled off again. And the same we're seeing with deaths, which peak later than our hospitalizations and the cases. We've now seen a leveling off and we hope a steady decrease. Again, looking at both the hospital and critical care, so that's people who require ICU care, and this is our daily occupancy per million population. So that puts it in a perspective, and really what it shows us is the impact, the dramatic impact that the pandemic has been having recently on our healthcare system in the north, and that's something we've been paying a lot of attention to try and support the healthcare workers in our system, and we've had on many occasions to have to move people around who needed care to other parts of the province to support the ongoing pressures in the north. This is an updated of our distribution of cases, hospitalizations, ICU, and deaths by age. We continue to see that the older we get, the more likely there is to be hospitalization, to require ICU care, and particularly people over age 70 are much more likely to die from COVID-19. And this, of course, is one of the important measures that we are using to drive our immunization program with the limited amounts of vaccine that we have right now, making sure that we can protect those people most at risk of hospitalization, of needing ICU care, and of course of dying from COVID-19 is our primary priority. Not only does that protect individuals, our seniors and elders in particular, but it also takes pressure off our health care system so that we're able to make sure we can provide care for everybody who needs it in the province. The other important thing that we continue to see in this that's reflected here is that people under the age, children and youth under the age of 19 and particularly under the age of 10 are still underrepresented compared to the proportion in the population, which is one of the positive things that we have out of this pandemic, reinforcing that young people are much less likely to be infected and also, thankfully, less likely to have severe illness. This is a bit of update of some of the data we have on school-age children that we've been watching carefully. Those 5 to 12 and 13 to 18, as I mentioned, particularly the 5 to 12, the young children, underrepresented in the number of cases that we've seen across the province. And this reflects what we've seen around the world, across Canada as well, that school-age children are less likely to be infected, less likely to get sick from COVID-19. To put that in perspective for us here in BC, the top line here, the red line, is the cases in all ages, and we can see that school-age children are underrepresented, still less than 10% of our cases overall, and we see a decrease in cases once school is starting and reflecting really transmission in the community. I'll go quickly through these. These are just comparisons again of our case rates in British Columbia compared to other jurisdictions in Canada, and this is the death rates that we've been seeing in British Columbia compared to other jurisdictions in Canada and internationally. We can see that around the world people have experienced varying degrees of severity in our second waves, but that across the board things are starting to settle down. And despite the concerns that we're seeing with the rapid increase in some countries, the UK in particular, France, Portugal, Ireland, related to more infective variants that have arisen in the last few months. This, again, being a lag indicator, taking some time before it shows up, the daily death rates compared to other populations. Very concerning, of course, is that some of these new variants have now been associated with increased severity of illness, and that is very worrisome. So all of that data goes into helping us understand the trajectory of our pandemic here in BC and where we are in terms of the potential for rapid takeoff or growth of the pandemic again. And this is the reproductive number, the average daily number of new infections per case. And this is a composite number that helps us understand where we are in terms of how many people every case is transmitting to. But we do know from this virus that that this is an average, and the majority of people who are infected don't transmit to anybody. But some people have what we call, are involved in what we call super spreader events, where a person can transmit to many others. So when we look at an average, we have to remember that. It doesn't always reflect the potential of each individual. But the good news here is at or above 1 for much of the last few months. In the last couple of weeks, we've seen that curve bend down again. And now that we've had the number of cases we have, we can look at this in more granular way across the province. The numbers are more stable. The higher the cases, the higher the population. So really, when we look at Fraser Health, we see that it's nicely come down under 1. Vancouver Coastal Health has been hovering around 1, and that's primarily related to some of the transmission events and the ongoing transmission concerns in places like Whistler and other parts of the North Shore, Coast Garibaldi area of Vancouver Coastal. The interior, where we've seen clusters in a number of communities take off quite rapidly, it seems to be settling down now, and the reproductive number again has come down below 1, and we've seen that as well for the north, although the numbers are small here, so the change can mean a big difference in terms of stress on our communities and the healthcare system. And on Vancouver Island, we've had an increase over the last number of weeks, but that is slowly coming down again. This then leads into helping us understand the modeling that allows us to get a sense of what could happen in the future, given where we are today and the history of what's happened in the past. So this is a figure that will be familiar. We've updated it, and we've now seen, since December, a steady decrease in our cases and our transmissions over time. The background, however, gives us a sense of the uncertainty and potential. And what we do know is that we are on a good trajectory, but it could change very quickly, and we could see rapid increases like we have seen in other countries and other provinces on a very rapid period of time. And when we look at the models describing these trends by health authority, we see these stable or declining trends all across the province, which is good news. The challenge is maintaining this. We do not need or want to see rapid inflections, and that is a possibility based on these models. And it has to do with our interactions and making sure that our interactions continue to be safe and prevent transmission of infection. When we look at the scenarios that could possibly happen, should we start increasing our contacts? And what we're talking about are infectious contacts. That means contacts that are risky and may allow the virus to be transmitted from somebody who's infected to one or multiple other people. Right now, when we look at these model parameters, we're probably somewhere in the 40 to 50% of our infectious contact rate compared to pre-pandemic. So that means that we are doing the things that we need to do to stay apart, to keep our safe distances, to wear masks, stay away from others when we're sick. These are all the things that we know reduce our rate of infections, reduce the probability that we're going to pass the virus on to somebody else if we're sick ourselves. Where we have concerns is that we can end up into the bottom scenarios where we have rapid growth of this virus, and we've seen that happen. It can happen in a variety of ways. One, it can happen by us having more social interactions or gatherings or coming into contact without the precautions in place with a large number of people. The other thing that can drive this is the new variants of concern. And we call them variants of concern because it means that they are more infectious than the virus, the strain of the virus that we've seen circulating for the most part so far in our communities. And with more infectious, it means that even if we slip a little bit, the potential for transmission goes up. And this is what is concerning for us right now. We do not need or want to be in that situation where we start to see rapid growth. And there's a couple of ways that these variants can cause concerns for us, and I'll talk about that in a minute. On our positive side, the things that are going to protect us and get us out of this pandemic is about having access to vaccination and being immunized. So far in British Columbia, we've received 156,250 doses of vaccine, both the Pfizer and the Moderna vaccine, and we've administered almost all of it. We did receive some vaccine this week from Pfizer, and we're due to receive more of the Moderna vaccine. Some of it has come already, and more of it will be coming this weekend. Our focus of the immunization program, as we know, has been particularly on protecting those most at risk, and that is our seniors, elders, and residents of long-term care. And we have done fairly well at getting first doses into the vast majority of our long-term care residents across the province, 87% based on the target, the number of residents that we know, and we'll have more detailed breakdowns of this information by care facility in the coming week. But there are some people who have not been able to receive immunization, primarily because they've been recently infected with the virus. And we've gone in to immunize in care homes where we're having outbreaks, and we're now seeing it is helping us to stop those outbreaks rapidly. However, unfortunately, some people are still in the acute phase of infection and can't be vaccinated, but we will catch them up in a few weeks. As well, some people have not had consent, but that's a very small number. Also, very importantly, is making sure that we protect the circle around those most vulnerable people in long-term care, and that's immunizing staff and people who work in care homes. And again, we've had very high uptake in most places around the province, and we'll be looking at this in more detail on a facility-by-facility basis in the coming week. We also have been focusing on people who live in our registered assisted living residents, and this is an ongoing initiative to make sure that we capture most and all of those people who are most at risk and people who are working in those settings as well. Very important part of our immunization program is making sure that we have a safety surveillance system that allows us to know every single dose by lot number and by vaccine that goes into every person's arms. This is incredibly important, particularly because these are new vaccines. And as more vaccines come online, we need to be able to monitor for safety signals. And safety signals are signals that come up when large amounts of vaccine are used in large numbers of people. And so we now have millions of people around the world. The clinical trials that were done had 40,000, 50,000 people in them, and you would expect to see any common safety concerns, but not rare events. So what we have been doing is we're part of a national and international system of monitoring for safety, and the good news is around the world, across Canada and here in BC, we have identified no new safety signals with either of the vaccines that we're using, with over 145,000 doses, as I mentioned being administered here in BC. So we have had 205 what we call adverse events following immunization, APEs. These are written out events that we have been monitoring with all vaccines for a long time. So we know that this means people are watching very carefully for these. We have approximately 14 APEs or adverse events reports for every 10,000 doses of vaccine. So that's not unexpected. In BC, we've had 55 people who are classified as having a serious adverse event, including mostly severe allergic reactions or anaphylaxis. This is something that we've seen that came out of the clinical trials with the vaccines that we have, and we've seen around the world, and we are monitoring very carefully. It's also something that's not unexpected with a vaccine or any medication, and we have provisions with all of our immunization clinics to make sure that we can detect and care for people who have this type of reactions and treat them. And so far, everybody has recovered from these allergic reactions, and only a very small number of people have had to be in hospital for a short period of time. Importantly, there are events that can happen, particularly when we're immunizing older people, that are temporarily associated with the vaccine but are not caused by the vaccine. And we're very careful. We have what's called a causality committee that does this work in BC, across Canada, and with the WHO internationally to monitor very carefully. And so far we have not seen any serious events caused by the vaccine. I want to finish by talking a little bit about variants of concern. These are something that have entered our lexicon in the last few weeks, particularly because of one variant that was detected in the UK to start with that was associated with increased transmissibility, rapidly increasing numbers of people being infected. And this virus is an RNA virus. That means it has a single genomic sequence, which means that every time it replicates, there's a potential for a mutation or a change to happen. I liken it to, it doesn't have a spell checker. So sometimes the genetic code can get it wrong and misspell. And that can, in some cases, lead to a virus that has some sort of ability to take over or spread faster, gives it an advantage. And this is one of the things that we've seen in the UK, that the virus variant that was detected in the UK meant that it could be transmitted more easily to others. And more worrisome, in the last week or so, there's also been some data that suggests it might cause more severe illness. Sometimes it's very difficult to tease that apart because we know the more people that are infected, the more people are going to have serious illness. But there is some concern about that, and that is very concerning to us as well. In BC, we have been using whole genome sequencing, so that's doing the sequence of the about 30,000 base pairs that make up this virus's genetic material on an ongoing basis to help us understand how the virus is moving in our population. And it was one of the things that helped us determine early on that we were seeing increase in people coming in from Washington State, from Europe, etc. It's how we detected the first importation of a virus that somebody had picked up in Iran. Right now, we do about 750 whole genome sequences on positive tests per week. But the BC CDC lab, as working with partners across the country, is developing a screening marker so that we can screen thousands of samples per week, hopefully get to all of the positive samples being screened for this, and then if this marker lights up, doing the whole genome sequencing on those targeted isolates, we call them, or the swabs, the virus that's being detected from cases. So right now, we are doing whole genome sequencing to look for the variants of concern that have been identified internationally. So there are many other variants out there, slight changes. As we've seen, it changes about 2 mutations per month. But these ones are concerned because, as I mentioned, they have increased transmissibility, and there's some concern that the variant from South Africa may give it some ability to, the vaccine may not work as well. Some vaccines may not work as well in that variant. So this is what we have as of yesterday here in British Columbia. We've sequenced about 4,500 cases, and we've detected both either the UK or the South African variant in 28 cases. Of the UK variant, 14 of those cases were directly were people who had histories of travel directly from the UK, from Ireland, from Dubai. There's a few other countries as well. And there were 5 individuals who had this variant who were close contacts of somebody who traveled. So far, those variants seem to be relatively contained, but it is concerning to us that we continue to have transmission in our community of these variants, the UK variant in particular, and we're increasing our screening and targeting of outbreaks and other places to make sure that we are finding and containing this variant. Of concern to us is we also have 8 cases of the variant B1351, which was first detected in South Africa, that were acquired locally. And in 5 of these, we do not know where that person acquired the virus. 3 of them were contacts of somebody who had acquired the virus either from travel or locally. So this is more concerning to us. Again, we don't seem to be seeing widespread variants here in the province yet, but we are stepping up our surveillance and targeted surveillance to better understand where we are. And if for those who are following, we have seen an increase. We had only a few of these detected, even as early as last week, and we've now had double the number within this past week. So this is something we are watching and are of great concern. This is just a schematic to help you understand a little bit about how we use these variants, this whole genome sequencing, to understand transmission and transmission patterns. So what this shows is a phylogenetic tree. It's kind of like an ancestry tree with the ones that are on the same line or the same fork being more closely related. So they would be brothers and sisters compared to cousins that are on a different branch of this tree. And this is all of the whole genome sequencing that we've done in BC in the last little while. And in blue, there are the small number of dots that represent these variants of concern. And finally, this is a tool, and this is a pattern that we use when we're looking at outbreaks in British Columbia. And this is the phylogenetic tree with one particular outbreak that helped us understand that it wasn't all transmission with one introduction, because we can see that there's 2 different families of virus that have been transmitted in this outbreak, and that tells us that it wasn't all from one introduction, that there was more than one person who brought that virus into that outbreak. And that is one way that we do our outbreak investigations, helps us to understand the transmission of the virus in different settings. So with that, I'm going to talk a little bit about where does that leave us now. So what this modeling and the epidemiology tells us is that we are seeing some encouraging signs here in BC. The efforts that we are all doing here in BC are working. Through our individual and collective efforts, the average number of new infections with each new case, so that reproductive number, is now down below 0, below 1. And that's where we need to keep it. Since our immunization program got underway, we've seen a dramatic and sustained decrease in illness amongst our most elderly and susceptible to severe illness. And this is important and welcome news for us all. By spending less time with others, by staying local, using our layers of protection, we are bending our curve, slowly and steadily. but we need to protect the progress we have made since the start of this year and not squander our success. To do this, we need to use this time to buy ourselves more time, to get our immunization program fully back on track, push our cases down further. And this will allow us to respond quickly and rapidly to any surge in variants of concern that may come up very quickly. We only need look around us to see how severe the impact can be if we don't have a buffer in our healthcare capacity, and this is our time to do that. With this in mind, I am keeping the current province-wide public health orders on gathering and events in place. I will be continually reviewing and reconsider the need for these restrictions based on the incidence and prevalence of the virus, the data that we've shown today, any new information about transmission, and the progress of our vaccination supply and our immunization program. Right now, we need to stay the path. We need to buy time. We need to buy time to understand how these variants of concern, or whether these variants of concern, are going to affect transmission in our community. And we need to buy time to get our immunization program back up and running at full speed. Just one or two super spreading events in our network, or a slight increase in our contacts or risky contacts with others, can quickly counteract all of our progress and work, especially with that increasing information we have about these more transmissible variants. Seeing one more friend, having one birthday party with those outside our household is all that it may take in our communities. And communities around BC have seen this in this last few months. Places where we have not seen transmission before, social gatherings that happened over the Christmas break, for example, social gatherings that have happened in ski hills and other places have led to rapid transmission in some communities. We want and need a smooth, flat path to the finish, with few and, if any, hurdles like outbreaks or unchecked transmission in more communities. We're not quite there yet, but we are getting closer every day. Each holiday and occasion this month, whether it's the Super Bowl this Sunday, Lunar New Year, Family Day, Valentine's Day, it's an important opportunity for us to either allow the virus to spread or to slow it down even more. Whether we're in Whistler, Revelstoke, Prince Rupert, Victoria, the choice is ours right now to make the difference. We all want to get to the days where these orders can be lifted. As we look towards the end of this month, these data will tell us if more action is required or if we can start to ease the restrictions we have in place. Through our shared efforts, and as long as we continue on this path, we can start planning for the return of activities at the end of this month. Looking ahead, we are working and continue to work with Via Sport, and we can start to put plans in place to get youth sport up and running by the end of this month. We can start with faith services to prepare to resume services with full plans in place to ensure everyone is safe. And all of us can start to resume some of those important social interactions in a moderate way, those connections that have been missing. So by the end of the month, once again, we can look to having our safe six, our bubble, again. The same group of people, whether that's our grandparents, close family, or a close single group of friends. Staying small, staying local right now for the next while will mean fewer cases, means fewer outbreaks, means fewer severe illness, fewer people in hospitals, fewer people dying. These are the signs that I and we will be watching through the hard push that we have on right now to the end of this month. We need to continue this for the next while, today, tomorrow, this weekend, and next, so we can get to those brighter, safer days ahead. Spring is coming, the summer is coming. We need to get there by minimizing the impact on our communities now. And we need to do that by being kind, being calm, and staying safe.
By acknowledging those people who have passed away from COVID-19, the 6 people who passed away yesterday, all in the Fraser Health Authority, the 1,240 people who have died from COVID-19 since the beginning of the pandemic. Just to say, and we'll be providing the numbers for today, later today, but just to acknowledge that sense of loss that communities, that caregivers, and of course families have felt at the losses, the profound losses that have occurred during this pandemic. And they remind us as well of the need, and all of our need, to continue our work to stop transmission of COVID-19. I'm not going to add anything to the modeling today, except to note page 25, which shows, if people have the modeling in front of them, or we'll see it later, which shows different paths that can happen based on all of our activities. Some of that responsibility is to the health system, but a lot of that responsibility is for us as individuals to ensure that we reduce and continue to reduce infectious contact. It's why the current health orders have been extended, and why we continue to need to take action in this crucial time as we're developing our immunization campaign and the vaccination campaign in British Columbia. It is very important now that we focus in, especially in these next few weeks, on reducing those contacts so we can reduce transmission, and hopefully looking forward to future months and in the spring to being able to do more than we're able to do now, and to see some relaxation in public health orders. Yesterday I was asked about immunization in First Nations communities, and I just wanted to give an update on some of the details of that. As you know, we identified a target of 25,000 doses for remote and isolated Indigenous communities by the end of March 2021. It's our expectation that we will meet that goal. Indeed, it's our expectation from the federal government that even those vaccines that have not come to British Columbia in the last short period will be provided and be made up for by the end of March. To the end of February 3rd, which is Wednesday, within that category of remote and isolated Indigenous communities, we've administered 12,800 first doses and 247 second doses for a total of 13,047 doses. Obviously, the reduction in vaccine supply, particularly in this case Moderna, creates some challenges, but we're expecting to achieve our target on the assumption of increased supply in March. Wanted to note as well, and Dr. Henry has talked about this, in addition to the very significant achievement, I think, of vaccination in long-term care of residents and staff throughout British Columbia. Thousands, close to 5,000 essential visitors have also been immunized, and the effect of immunization in long-term care has been positive. There were 49 outbreaks on January 15th in long-term care, assisted living, and independent living. Today there are 23 in long-term care and 1 in independent living, none in assisted living, and that shows the progress has been made. And recent outbreaks have tended to be the ones that have occurred in the last 2 weeks have been smaller outbreaks, not the kind of outbreaks that we saw in November and December and the early part of January, which is heartening. That said, we're continuing in existing outbreaks to see the impact on residents in long-term care and their families of COVID-19 and its profound impact in all of those care homes, and all steps are being taken both to support those who have tested positive for COVID-19 and to prevent transmission. And I wanted to say it's very important as well that we finish second doses in long-term care, and we are going to continue to do that so that we can take steps, the other set of steps we need to take following that, to allow more access and more normalcy to return to long-term care homes and to the lives of its residents. I wanted to say a couple of things briefly about ski hills, and just to note, and you see this in the material, but it doesn't stand up as well, that Vancouver Coastal Health will be advising later in one of its advisories later today that there's been a total of 547 cases of COVID-19 in Whistler from January 1st to February 2nd. We also saw, and you can see it in the maps, cases, of course, of Big White, which we've heard about, but in communities such as Fernie, across British Columbia. The majority of the cases in Whistler continue to be identified in young people in their 20s and 30s who live, work, and socialize together. I should note that to date, 2 of those cases, only 2, have required brief hospitalizations and no deaths have occurred. Almost all of the recent cases are associated with transmission occurring within households and social settings, according to our contact tracing. And we obviously saw a similar increase in cases in November 2020, which was resolved in early December. Actions significant, as you will know from last weekend, significant enforcement actions are taking place at Whistler. I want to acknowledge Dr. Henry and I have spent time, and we're working with the Mayor of Whistler, Jack Crompton, who's played an extraordinary leadership role, I think, in the whole province on this question. I want to acknowledge his work. The industry in ski communities across BC, the Ministry of Tourism has implemented some measures and will be laying out its full action plan. I think the ministry and a provincial one next week to reduce transmission, which is important because obviously we want to take those actions that focus in on the source of transmission and limit transmission and not have to take broader action with respect to the entire industry. So I'm very, very appreciative, and I want to salute in particular the work of Mayor Crompton and of people who are working on this file within government, and my colleagues, Ministers Osborne and Mark. And so that's where those are just a few updates, and just to say that today's modeling and data indicate that the hard work for each of us have made a difference. And I want to acknowledge in particular Fraser Health. If you look at active cases, Fraser Health is approximately 38% of the provincial population, and they're just under 40% of active cases in BC. And this is very different than what we saw in September and what we saw in October and what we saw in November. So there has been significant work done there, and we want to acknowledge that work and the overall reduction in cases back to the provincial average. Not that there aren't still cases, but back to the provincial average there. But this is familiar terrain for all of us. We bent our curve last spring, only to see COVID-19 fight back with all its might. What makes this time different is there's vaccines, and they've started to give the protection to those who we all wanted to get it first and who needed it most, our family and friends in long-term care and assisted living, and those who care for them. But what also makes this time different is that COVID-19 is fighting back even harder. Its new variants have potential to make us sick faster, and still cost lives, and still take so much from us. As Dr. Henry has shown, COVID-19 is not giving up, and so neither can we. The message from today is clear. Hold steady in our efforts to stop the spread. Hold fast to the knowledge that our masks, our hand washing, our physical distancing, our work, and our sacrifice save lives, and they do. And always, always hold on to the certainty that the difference is still down to each of us and the actions we take to stop the spread. Our BC vaccination plan will work. More vaccines will arrive and more British Columbians will receive their shot. That will take time, and we know what we must do to make our plan work. As we await vaccines and our turn for our shot, our efforts to stop the spread have never mattered more, and we won't let each other down. And with that, Dr. Henry and I are happy to take your questions.
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon only. Also, please do not mute your phones. You will not be heard until I call your name. We begin today with Juan Palmer, Vancouver Sun.
Good day, Dr. Henry. Thank you for the briefing. Appreciated. In addition to the 3 variants that you discuss in the briefing, I'm seeing coverage south of the border of what it is being called the California variant, apparently a virus active, or a version of the virus active in the Los Angeles area. Is that something British Columbia should be concerned about, and would your the checking that's going on here be in a way of catching that if it showed up here in British Columbia?
Yeah, so absolutely. There's been a couple of variants in the U.S. as well. I want to say, I won't remember, it's one of the southern states as well that arose not that long ago. So these are concerning. And what they reflect is when you have a lot of transmission in the community, there's more opportunity for these mutations to happen and for them to lead to something that gives that strain of the virus opportunity over others. And so it can start to spread more rapidly. And we're seeing that in LA. We're seeing that in the UK was the first that really alerted us to this concern. So that's why we get fussed about wanting to reduce transmission. You know, we say, well, it doesn't seem to cause severe illness in young people, so what's the big deal? Well, the big deal is that even though it may not make you that sick, the replication of the virus could lead to another mutation or a variance. And we know that these, the ones that we've been concerned about have been introduced into BC, and we're not yet certain sort of how many of them. So every transmission runs that risk. So yes, we need to be concerned about it. And yes, our whole genome sequencing will pick up any of those variants. And there's a international website that puts all of these different ones up there so that we know which are the ones of concern. And there's specific pieces of the, I believe it was 17 different mutations in the UK variant, for example. But only one or two of those mutations were ones that lead to the increased transmissibility. So the screening test that is being developed at the BC CDC. They're doing it in Ontario, in Alberta as well, and we're working across the country on making sure we can pick up the ones that are of concern, should detect the concerning pieces in the variant from LA as well. And the whole genome sequencing allows us to look at those ones. So we've picked up a huge number of variants across BC, and that phylogenetic tree shows you all the different strains, but that's why we're calling some specific one variants of concern. So the one from LA is still being analyzed by our lab colleagues about whether it does confer this this competitive advantage to that virus or not.
Do you have a follow-up, Vaughn?
Yes, please. I wondered if there is any particular precautions that need to be taken by British Columbia because of the significant volume of truck traffic and goods shipment back and forth between British Columbia and California. It wouldn't be so much air travel here as surface travel that might bring it in.
Yeah, we've had a lot of conversations about that. As you know, that the border is a shared responsibility, but primarily a federal responsibility. And we have been talking about the need to have a consolidated program of testing of people who go back and forth across the border regularly. And you bring up a very good point. One of the challenges, one of the geographic realities that we live in British Columbia is that we are dependent on essential goods and services from across the continent, and that makes it much more challenging for us to get to things like COVID-0, where people can control who's coming in. There is a lot of traffic, primarily truck traffic back and forth, especially from California. So we are in discussions with the federal government about how do we put in a rational way and hopefully a coordinated way with the U.S. of having periodic testing of people who are essential workers coming back and forth across the border.
The next question comes from Jill Sperling, CFJC.
Hi, Dr. Henry. Thank you for taking my questions. I'm wondering, have you received a proposal from the Western Hockey League for a return to play for the 5 BC teams? And would a hub concept with play in Kamloops and Kelowna meet your current restrictions?
The current restrictions, no, because some of the important restrictions we have in place that are necessary right now are about travel and about people coming from different areas together. My office received a proposal early in January that did not meet the considerations that we had in place currently. I know we've received some emails about other thoughts that they had about different types of hubs. Haven't seen that in detail yet, but I am hopeful. This is one of the things that we need to plan for. If things go well during this period of time, we are buying time, as I've said a couple of times. We're buying time right now, between now and the end of the month, to understand these variants of concern, to get a better handle on them, now that we have some more restrictions on travel and borders, and to get our immunization program off and running again. So nothing will change in this period of time, but absolutely, I want to work with the Western Hockey League so that we can salvage a spring season for them.
Follow-up?
Yes, thank you. We have heard from multiple workers inside Royal Inland Hospital that the outbreak there has spread beyond the 6th floor. However, yesterday, Interior Health did not confirm this for reporters. Why are we seeing such a discrepancy in information between the health authority and those working in the hospital?
Yeah, so I can't answer that directly, other than I know that there was investigations ongoing and testing ongoing in other parts of the hospital to understand the spread, and there are often concerns that may or may not bear out. So I know the investigation is ongoing, and the people who are doing those investigations, partly the public health team with the infection control team and operations at Interior Health, are actively managing every single concern in that hospital.
Thank you. The next question comes from Justine Hunter, Globe and Mail.
Hi, thank you. The exposure of the variant is still in BC is still low, but we've got limited capacity to do the screening. I know you said you're stepping up surveillance. I just wondering if you could walk me through exactly what that looks like. Are you shifting contact tracing resources or putting more into the genome sequencing, or is there this other branch of screening that you're looking at? I just want to get a better idea.
So the short answer is all three. So when I talk about surveillance, part of it is lab surveillance. So using the marker, the indicator test, which is part of the PCR test we're going to ramp up to do it on every single case in BC, but that should be in place in the coming days. I've been talking with Dr. Krajden about pulling that together, and they are moving ahead with that one, so that should happen very quickly, and that will help us target the whole genome sequencing. We're also increasing our capacity to do more whole genome sequences. It takes a lot longer to do them, and there's a delay sometimes. So part of our surveillance is trying to ramp up our screening lab test that helps us identify which are the ones that are likely to have these variants of concern, or at least part of them. So that's one phase that we're doing. We're also very targeting more concerning outbreaks, spread in communities, and people of specific age groups. We've been focusing on ensuring children of school age, for example, that we do oversample and do whole genome sequencing on people who are positive in that age group, and of course anybody who's positive from international travel. Along with that, on the public health side, we are doing more intensive follow-up around people who are identified as having one of the variants. So that means testing in all of their close contacts, where we might have said only to get tested if you develop symptoms, making sure that people are more effectively isolated. And this is another place where the actions that the federal government are taking finally to ensure that people are maintaining quarantine and are being tested at day 7 and day 10. So we're doing the same thing when people are tested prior to coming out of quarantine if they've been exposed to somebody with a variant, and things like the additional testing that we're doing around even non-close contacts, for example, the school testing that we did in Fraser Health this past week.
Follow-up, Justine?
Yes, thanks. And this is more around the immunization program. You talked about trying to buy more time to get that back on track. Under the plan that had been rolled out a couple of weeks ago, there was the expectation that, for example, seniors in the community would be getting calls from their doctor maybe in mid-February to try and book their first shot. So I'm just wondering if you can give us an update on what people who are kind of next in line in that second phase, when should they expect to start hearing about shots at this point?
Yeah, so that's, we were hoping mid-February, but the vaccine has not arrived, as you know, for this last 2 weeks. And even next week, it's going to be reduced from what we expected. And we are putting in place, so it's more the 1st of March. People who are 80 and above in the community who have not yet, a proportion of those people are people who live in care homes, long-term care, assisted living. So yes, we are putting in place a couple of things. So it will not necessarily be your family doctor who will call you. We will be connecting with people in a number of ways. That is currently under being worked out. So we're using what we know about people by age and their MSP, for example, to connect with them. Service BC is working, we're setting up a hotline so that we can call people, and there will be much more information in the coming weeks, probably the week after next, very detailed so that individuals, their family members, our community members, we can support everybody in booking an appointment, making sure we know people who cannot get out for appointments, and we'll be going through places like assisted or independent living homes to connect with people who are in those settings. So that is something that Dr. Ballum and her team are being put together right now. So please be patient. We will have much more information about this, both through the public, to people directly, through your care providers, through community groups, to connect with our elders and seniors and get them immunized as soon as we can. And the target is to be starting with our mass clinics as soon as vaccine is available in March.
Thank you. The next question comes from Richard Zussman, Global News.
Dr. Henry, we've heard you refer a few times to the end of February. Can you give British Columbians sort of a deadline of what you are looking for over the next few weeks in order to ease the restrictions? Is it a certain number of cases? Is it a certain number of variants? Is it a number of vaccines? Like, what are you looking at for numbers to reassess these restrictions?
It's all of those. So yes, I will be looking at, are we on a continual down? Where are clusters happening? Helping to understand where transmission is happening in the community. But case rates are an important piece of it. Looking at outbreaks is an important piece. Looking at whether these variants are taking off or increasing. So part of it is having that more detailed multi-layered surveillance in place. So it is all of the above, and it is also making sure that we are starting on that road to be able to protect those who are most at risk in the communities.
Follow-up, Richard? Richard, do you have a follow-up?
I do. How should people assess what is happening here? I think as you know, in life, people work very well on deadlines, and there seems to be a broad deadline here, but nothing specific.
Yeah, so that is intentional. We've set dates that become the sort of I guess where people are looking to. What I'm saying is we are in a place of a little bit of more uncertainty, and that we need to buy some time to understand if this positive things that we're seeing are going to allow us to increase some of the, or take away some of the restrictions we have in place now and be able to do that safely. So we don't yet know what that is. And that's why I'm leaving it open-ended. I'm not putting an end to the orders that are in place now, but I will be continuously reviewing the data that we have to see if we can do it earlier than the end of the month. But I want people to start thinking about, it's not going to be, yay, we're out of this, we're back to normal. It's going to be, can we slowly and thoughtfully find an increase in those social connections that we all really want, and some of the activities that we've had to curtail because of these risk of transmission, and do that in a safe way in the coming weeks. And much of it will depend if we start to see, I hope we won't, we start to see one of these variants take off, then all bets are off, and we may need to actually increase some of the restrictions that we have in place. I don't want to go there, but right now we need to buy that time to understand, to stay the course, so we can, part of getting immunization going again is really important to protect those who are most at risk, and that gives us a bit of buffer. People call it hardening, hardening the vulnerable. So that is something that's part of it as well. And I think we will be making good progress in the next couple of weeks, and if we can, we'll take off some of these restrictions earlier. So now's the time to prepare for how to do that safely. And I think if we look around at jurisdictions around us in Alberta and Ontario, Quebec, they are actually looking at lifting some of the restrictions to take them to a place where we are now. So we need to put that in context too. I want us to continue to be able to safely go to restaurants, to safely go to retail shops, to safely go to our hairdressers and other important businesses in our community. But we know that it's also important that it's not health or business, it's both of them together, to safely go to ski hills. So now's our period of time where we have to put that in the context of the risk that we're facing from some of the things like having these new variants on the horizon and being able to get second doses of vaccine into the most vulnerable in care homes. So that's about as specific as I can get right now.
Thank you. And the next question comes from Binder Sajjan, CTV.
Hi, Dr. Henry. I'm just wondering, given the delays we've seen in the vaccine rollout, you've spoken about how vaccine is back-end loaded. We'll be getting lots more in March. How big of a concern is that in terms of starting to slowly ease these restrictions, and what do you need to see there?
Yeah, I need to see more confidence that the actual vaccines are coming. Our strategy, was rolling out nicely, and it's been stretched out and delayed. So we need to be sure that we actually are getting the doses to meet those needs that we have. It is becoming more important we're realizing that the second dose in elderly people, for example, is probably an important safety measure to have in place in care homes. So those are some of the things that we're looking at. Just getting more confidence that the vaccines that we expect will be coming in time so that we can get our program up and running. I also, in the next few weeks, we should have additional vaccines available. So we're still in that limbo period waiting for those. So having a better understanding of when additional vaccines might be available and who we can target those vaccines to is the other part that we'll be balancing as well.
And just a reminder that the core of our vaccine program so far, and you see its impact in long-term care already, and we expect it to continue to have that impact, but the core of it is to focus on vulnerable communities. And those are our priorities. That's what we set. That's what we laid out in our plan, and that's what we're proceeding with, albeit with less vaccine, more slowly than we would like. But the expectation on that plan right now, Dr. Henry just talked about other vaccines in addition to Moderna and Pfizer that may come, is about 10% of the population by the end of March. That's the vaccine that we expect to come from the federal government. And it'll be less than 50% of the total vaccine by June 30th. So what that's going to require is continued action to reduce the spread in communities. So the vaccine will help especially protect the most vulnerable. And that has been at the core of what we've done in all of our actions to deal with COVID-19. But we need to recognize that in the short run, right now, we have to maintain our actions to reduce that level of continue to reduce and hold the line on transmission in the community. And that vaccine will protect a lot of vulnerable people, protect our healthcare institutions right now, but it's not the answer in and of itself until we get much more vaccine later on in phase 2 and then phase 3 of the plan.
Do you have a follow-up, Binder?
I do. Minister Dix, I wanted to see if you could expand a little bit on what you were saying there about Whistler. It sounds like there's more perhaps restrictions or there's a safety plan coming. Can you talk a little bit more about that? I know with young people in Whistler, they've often talked about, how expensive housing is, and so many end up living together. And just wondering if that means that there could be some sort of an isolation facility opening there.
I think, and Dr. Henry will speak about the issue of transmission in a second. I think it's important that we understand that. But I think that already last weekend you saw 61 inspections by WorkSafe BC, significant, I think a couple of dozen inspections by environmental health officers from Vancouver Coastal Health. So that work is happening. Right. One of the places we're seeing transmission is in social gatherings and social settings around Whistler. It's not skiing on the mountain that has been the principal source of transmission. So what we're doing is continuing that, increasing, and you'll see, I think, an increase in communications, and then more details of a plan, both from the industry involving health authorities, but also the Ministry of Tourism, to target transmission and to reduce transmission in the coming weeks. I think it's very important that we do that, because I think no one wants to take broader action that would curtail the season. But we need to take action now. The number of cases, more than 500 cases at Whistler, for example, from January 1st to February 2nd is too many. And the fact that it's only brought 2 hospitalizations at Whistler, because it's 547 cases in Whistler, remember. There may be other cases of transmission that are reflected in the place of residence of the person who tests positive with COVID-19. This is significant. It's also significant in Fernie and other communities around BC. So we have to take these steps now. I know the industry is very interested in doing that and involved and active in the plan, as are other parts of government. So we have to take some steps to focus on, make those workplaces and those communities safer. And the municipalities, I think, are doing a very good job, particularly Whistler, in engaging in this. And we just got to keep doing it, because regardless of the nature of the transmission or the seriousness of the illness, that's way, way, way too many cases.
I would just say that, public health has been working with the communities, Big White, Whistler, Fernie, and others. And yes, there are already places in hotels and other places where people who are infected can safely isolate without infecting others in their household or in their communal living setting. That's been in place with Vancouver Coastal for some time now to help support people who are infected. But, the other thing that we've been saying for some time as well is stay local. And for Whistler, that means day trips only. Right now is not the time to go up there and party. And that is important because the community needs to be protected from us, and we need, if we're going up to Whistler, not to bring those things back, not to bring the virus back with us to our community. So staying local is one of the important things that we all must do around the province, and for that, day trips is a good proxy for that. I know that means that there's a broader community that can do day trips up to Whistler, and that means they need to check ahead to make sure that there is space on the mountain. That's another issue that we've heard has been a concern, and I know the community is looking at how they can support that too.
Thank you. And we have time for one more question this morning. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. And the last question this morning comes from Marcella Bernardo.
Hi, Dr. Henry. I just heard you say that partying up at Whistler is not a good idea, but day trips are still okay. And we've been hearing from people who have passes to go to Whistler who say they don't want to go, they don't feel safe going. We've just been told there's almost 600 cases in the last month attached to that ski resort. What is your advice to people who are now being told that if they don't use their passes, they're going to lose them?
Yeah, so that is something that has been brought up to this industry group as we've been talking about. I know they're coming out with a plan. I expect it'll be next week. That is one of the concerns that has been brought to their attention. And I know the community is very concerned about that too.
Follow up?
So what specifically is being done to ensure that people are safe? Because you're telling people they can't go to church. You're telling people that they can't go to a movie. But it's okay to go to Whistler, where we now have almost 600 cases linked to that resort.
Yeah, so what I'm telling people is it's okay to go outside, to go skiing, and we know that that in itself is not a risk. It's the befores and the afters and the parties and the getting together and the social gatherings. Those have never been acceptable, and that is where we're seeing transmission happening in several communities. And that is why it's so important to visit, not vacation. It's going, if people, I know many families, skiing is part of their winter exercise and activity. It's outdoors, it's low risk if you go with your family to your local mountain.
Thank you, and that's all the time we have this morning. Thank you all for joining us.